Hi, I'm Richard Wrighton, I'm Practice Development Lead for Early Help. I think if we start from my direct work, which will be predominantly with practitioners, so what we'd start to see in terms of behaviours is people becoming more confident. They'll be thinking more structured and more clearly about their work and the reasons they're doing what they're doing, and having some understanding of the impact that work will have, and then being able to come back and kind of think, well, did that work? Did that not work? What have I learnt from that? And is it something that I could do again? Is it something that I need to adapt? But equally, it's very much around accepting that there is no answer, no solution that's 100% perfect, and it is generally through trial and error based on evidence, based on knowledge and experience. Every family is different, so therefore every intervention has to be slightly different in terms of their needs. However, there's kind of some broad messages and broad processes that you can follow to achieve. I also think we should see the language that's used more about what the family are doing, what they're doing for themselves, how confident they've become, the strengths that they have, and that's not necessarily about what we've done or what we've said. It's more about the things that the families have done. So the families become the focus, and we're sitting behind, we're, I suppose, to some extent catalysts for the change. That said, we will still change in some level because of the experiences we've had with the different families. Other things we will see is actually families helping themselves and their neighbours, their community. So I think we'll probably see more work, more collaborative work between professionals and families and communities going forward, so that they have more control over how things are done, where things are going. So particular families might be able to connect with people in their community as opposed to having a referral to a professional service. That said, there will always be a need, I suspect, for professional services. It's more about let's the community and the family deal with things first and foremost without coming to services to be seen to find the solution or fix things. So I think we'll see a lot more empowerment. That's quite a strong word really, but in terms of people doing things for themselves and feeling safe and comfortable, well supported in doing that. And I also think that we'll be looking more around how we find solutions to things. We'll have much more evidence of people being able to find solutions and focus on what can be done as opposed to what can't be done. So we're shifting people's thinking around situations around what might be perceived as a problem, and then identifying their own solutions. So again, it's fairly repetitive, but that's kind of what we need. I also would see that, because it's all around, for me, relationships, and it's relationships between families, so mum, dad, partners, children, extended family, the community, the neighbours, and then the relationships they will have with professional services organisations such as schools, such as early help, social care, the health services, and it's all around those services working together, the families working together, the children living in a situation where everything is much more harmonious and less conflict, and that differences are accepted and we can work through any problem or barrier that's presented to kind of get in the way, and that people are not living on their own. So no one person lives in isolation. There's a whole raft of people around them that can offer and help, and it is about relationships and making sure that they run smoothly, whatever's needed to get to where people need to be. I think, from my point of view, it will be very much around being supportive, being helpful, enabling managers to have enough time and focus to develop staff. It will be enabled for staff to help and support each other and to take the opportunity to share skills, share ideas, talk about things that have worked, and for teams to have an understanding that everybody has something to contribute. It doesn't matter what role you have skills, you have strengths, and it's about sharing that and feeling confident in that, and that managers can support staff in doing that. So I see myself as being very much a bit about offering the time and the opportunity for people to think and reflect and develop the practice. One of the real big things around people learning and developing new skills is having the opportunity to then bring it into their working practice and implementing it. And that takes some effort, because it's very easy to go back into old behaviours and different old ways of working. So part of my job really is to prepare people for the learning process, for the learners, practitioners to go on to training courses, learning programs, and understand that when they go back to work, that there's an expectation that they apply, but understand that they're supported in doing that, and we're constantly reflecting and reviewing that. And that's part of day-to-day work. It's part of the manager's process of understanding how the staff are doing through supervision or annual appraisals, and just having the time to think, well, where does this new learning fit? Let's give it a go, let's have a good go at it, and then let's reflect on that and see what we need to do to improve. Do we need to go back a bit more and spend some more time in a workshop format to hone those skills? Ultimately, if you're going to go on a training program or a learning process, it's understanding the process you need after you've done that initial learning and how that's going to embed into practice. And it takes time, and it takes repetitive processes, and I see that as my job to support that in happening.